Hello, I'm Anika Wells, Minister for Aged Care, coming to you from my new office here in Parliament House. This is my 94th day in this office, and we are proud of the reforms we have made to aged care, but obviously it's only the beginning. First, I'd like to acknowledge the traditional custodians of this land, the Ngunnawal and Ngambri people. Together we stand on the shoulders of 1,600 generations of First Nations people, and that is our shared history. Unfortunately, I cannot attend your conference in person, but I wanted to show you my appreciation to you all because of what you do matters. It really does. And the theme of your conference, Facing the Future Together, is so relevant because the key word obviously is together. Let's be collaborative, let's have ambition for aged care, let's find the best practice together. I know during the last decade you have wondered if the government of the day truly appreciates you. Well, this government of the day truly does. Thank you for keeping Australians safe and healthy. Thank you for caring. We are so appreciative of the work that Catholic Health does in this industry. More than 250,000 residential aged care beds and almost 30,000 home care package recipients. Thank you for taking pride in how our most vulnerable people in hospitals, residential aged care facilities and at home are treated. Even before becoming the Minister for Aged Care, I met so many people in my election of Lily who worked in aged care and felt let down by the previous government, people who felt undervalued. Those stories are part of why the Labor Albanese government asked the Fair Work Commission for a significant and meaningful pay rise for workers, because the aged care sector is significant and meaningful. And there are many aspects to reform, but a pay rise is central because, as you all know, we desperately need more staff. Carers look after our most vulnerable, bathing them, assisting with hygiene, assisting with movement, supporting them emotionally. And yet, the minimum wage for an entry-level residential aged care worker is just $22.67 an hour, just $1.29 more than the national minimum wage, $1.29. Ridiculous. I understand this is a specific problem firsthand. My mum Deb worked in an aged care facility for years, and I also worked in aged care part-time during university, and many of the same problems that mum had then, like filling shifts, we still have now. But the problems have been exacerbated after multiple governments failed to listen to people like my mum, people like yourselves. Righting wrongs will now take time. So even with higher pay, where will we find aged care staff? Our Workforce Roundtable last week was a productive prelude to the Prime Minister's Jobs and Skills Summit at the start of September, and I thank the amazing Pat Garcia and everyone who contributed. We have several initiatives being rolled out now. We will train more through our fee-free TAFE places and 20,000 additional university places for nursing. We will support providers to recruit and train 13,000 new personal care workers. And we will launch a skills development program for nurses, personal care workers and allied health workers. But despite all these measures, it is still likely we will have to draw experienced nurses and personal care workers from overseas. We are exploring streamlined pathways, including the expansion of the Aged Care Pacific Australia Labour Mobility Scheme to recruit more workers from outside Australia. These measures show the Labor Albanese government is determined to put the care back into aged care. But to do that, we need your help, and we need to help you. Band-aids don't interest us, we need surgical repair. Our plan is ambitious, and our plan needs providers to be ambitious too. I'm listening to stakeholders, I am responding to feedback. That will not change. But we will not be turning away from our central promises, like the requirement to have a registered nurse on duty in every residential aged care home at all times from July 2023, and an average of 215 minutes of care per day for residents starting in October 2024. Better food for residents, greater accountability and greater standards of integrity. We will offer flexibility for nurses while acknowledging the realities for some operators. We are bringing forward the capability review of the Aged Care Quality and Safety Commission. We will work closely with the Commission to ensure it has the power and resources to do its job. The Commission is responsible for improving the safety, health, wellbeing and quality of life for older Australians receiving funded aged care services. It is critical the Commission is fit for purpose. We need the support of all of you who share our passion for improving aged care, for restoring dignity to workers and to care recipients, for restoring humanity to the care sector, for all Australians, all of the time. That's my goal, and I know that is your goal too. It's only the beginning. Let's face the future together.